Hi, everyone, and welcome to Talk of the Town. Dieesha Hicks has joined us once again in her monthly visit. She is the manager of the State Health Insurance Assistance Program, and she is with us because of Medicare open enrollment still going on. Dieesha, welcome to Talk of the Town.
Good morning.
So let's begin with the end date. So we're in open enrollment, right?
hmm
And when does it end?
So the end date is December 7th. We have less than 3 weeks. It's approaching fast. It came through swiftly. Like it just seemed like we just started, but we are nearing the end of open enrollment.
And you were just telling me that you're getting a swarm of calls, high volume of
High
calls with
volume.
lots of questions. So what are some of the common questions that you were getting, Dieesha?
I feel like so many people are kind of confused this year because of so many changes, especially with the plans leaving the certain areas, and they're kind of just uncertain of where they fit in for next year, or if they're going to be able to afford their prescriptions. But you have to be vigilant. You have to remember that this is your health. So you want to make sure that you take the time, review your plans. If you need any assistance, I am here to walk you through it. But there are going to be some changes, but we could get through it together.
So I know we've talked about some of those changes, but we've got time. Let's review
Okay.
some of the most common changes that we're seeing this year.
The most common changes are the plans leaving our area. For instance, there are a lot of Humana plans that are leaving the Beaufort County area. There's the Aetna Medicare Premier plan that's leaving all of our counties. Clear Spring Health is leaving. Mutual of Omaha is no longer providing their drug plan. So there's just some of the changes that are going to be happening. Some of the providers are no longer taking Humana. For instance, MUSC in Charleston will no longer be taking Humana for 2025. So even if that plan is in your area, but you use MUSC doctors, you need to review your plan for something different for 2025.
And so let me ask you, Dieesha, if you have your coverage with that particular company, do you suggest other companies that you could change to?
Yeah, so typically if someone calls me and their plan is leaving, or if they just want to review the plan, we try to figure out what is best for them, like what are their needs, making sure that all of their prescriptions are covered and that their doctors are in that particular plan's network. So that's kind of the way we process that for them, just to make sure that they're good for next year, because once you're comfortable with the doctor, who wants to change it?
Right. What other questions are you getting in this high volume of calls?
Oh my God.
I know, runs a gamut, right? Just give us the high level.
Right. A lot of people are trying to figure out should they stick with the Medicare Advantage plan, or should they go back to original Medicare?
Oh,
That is the most confusing part, because with original Medicare, you can see any doctor that takes Medicare, so that you could go out of state, you could go cross state lines, and you can see any doctor that takes Medicare. But original Medicare doesn't cover dental, vision, and hearing. And sometimes those things are really important for people. So just trying to find that balance of what is needed and what's important for that particular individual.
and then, so if you don't have the advantage, then with Medicare, you should have a supplemental. You don't have to have a supplemental, but you sure, I know I do, and it's definitely helped.
It definitely helps pick up that 20% coinsurance that Medicare doesn't cover. And with people, I tell them sometimes it's a little pricey on the front end, but if something major happens, it is a godsend. Like you're not worried about having all those expensive bills, and you're just kind of comfortable with, I've had this procedure. Now I'm not worried about receiving all of those
Those
doctor bills or
bills.
hospital bills.
Very good. And again, you are there and your team to answer any question. Most important thing to remember, everyone, is that the end date for open enrollment will be December the 7th. That is a Saturday, I
Saturday.
believe. Very good.
And I probably will work it that Saturday.
I'm sure you will. We have about 10 seconds left. Anything else? Any final quick message, Dieesha?
My quick message, one is, it is my mom's birthday, and I just want to say happy birthday, Miss Judy Hicks. We love you. And that if you are confused, just reach out to us and we'll help you get through it. And three things to remember: Medicare, Medicaid, nor Social Security is going to call you first. That is not them on the phone.
They don't, right. Yeah, I heard that this week. They will not call you. You have to call
Have
them.
to call them.
All right. Thank you, Dieesha. Happy Thanksgiving to you.
Happy Thanksgiving to you guys too. It's been a pleasure.
Okay, bye-bye.